Hello, Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cachoa, and I'm here with PAR5 Physical Therapy, partnering with Better Spaces to bring you an easy and educational workday session. Today's session is how pro golfers deal with back pain. A little bit about me. I'm a physical therapist and orthopedic clinical specialist, and I've been in the field for over 25 years, and for the past 15 of those years, I've been working with golfers who have injuries, who don't have injuries, and I'm helping them to move better, feel better, and play better. So let me pull up my slide here and we'll get started. So how pro golfers deal with back pain. Now, just because I'm a physical therapist and medical professional, I have to put this disclaimer up that if you're dealing with pain or any specific injury, this talk today, this class is going to be with general information that's targeted at a broad population. So be aware that if you're going to need a customized assessment and a thorough physical exam to develop a treatment plan to successfully treat all the components that may be at the root cause of your specific dysfunction or problem. Alrighty. So the needs of the golfers, professional golfers and the amateur golfer, they vary by degree and not kind. Exercise and recovery is important. Professional golfers have a team around them. They have a chiropractor, athletic trainer, physical therapist, whoever, sports psychologist, swing coach. That whole team keeps them up and using their body week in, week out so that they can perform at the top of their game. Now, with amateur golfers, we still need to have those components. We need to be aware that there's certain things that we need to be able to do with our body to recover and to strengthen and be more flexible so that we can go out and play and not have injuries. So for the most part, professional golfers deal with injuries because it's a repetitive stress problem, right? So they're playing, they're hitting thousands of balls a week, and they're dealing with it because they're just doing something over and over again. But for amateur golfers, it's mostly their injuries are due to poor mechanics or poor technique. So they're limited with the ability to move as well as professional golfers, and they're still trying to play, and then that can lead into injuries and pains and aches down the line. So understanding how the body functions, it functions on this alternating pattern of stability and mobility. If we understand this, then we can treat how the back gets injured, okay? So for golfers specifically, there's a lot of rotation. The mobile segments of the body that we're most concerned with for golfers are the hips, the thoracic spine, but the lower back needs to be stable. So a stable lower back and a mobile T-spine and a mobile hip or pelvis. So when we're having tightness in the T-spine or tightness in the hips, the lower back tends to reverse its role and become a mobile segment. And then that tends to be the root cause of why we have back pain. So looking at the golf swing itself, it's a rotational kinematic sequence. All right, we're going to zoom in here and understand what this swing involves. So the red all the way at the left here is the lower body. And that's going to be, you're going to represent that in the graph. It's going to be coming up in our next slide. The green is the torso. The blue color is the arms, and the gold is the club. So at the top of the backswing, we want the pelvis to move first, then the thorax and the arm, and then the club. The kinematic sequence, like a whip, we transmit force and speed from one segment to the other. Each segment builds on the previous segment, increasing speed up the chain. Now, and then each segment then also of the chain needs to slow down once the next segment begins to accelerate. So it's able to transmit its speed and force to the next segment, like dominoes. So with this graph here, we have on the left-hand side at the address position, and the lines here represent rotational speed. Now at address, there's nothing moving, and then at the top, as we go into the backswing, everything's going in the negative direction. Things are going downward. And then at the top here, and then through the downswing, this gray area, this is where we try and generate the most amount of speed. So the increase and the peak speed here, you can see the red is the first thing that gets fast in this timeline here. And then the next thing that reaches its peak speed is the thorax, the torso. And then the next thing that reaches its peak speed quickly right after that is the arm. And then finally the club at the top over here at impact. We want that to move the fastest. So as one segment increases its speed, it then decreases after its peak. And that's because it transfers its speed to the next sequence, to the next segment. All right. So the key for acceleration is being able to decelerate. You need stability in one segment to transmit the speed to the other. Imagine analogy that I like to use is if you're swimming in a pool and you're racing somebody, the easiest way, if that swimmer is directly in front of you, the easiest way to outswim them is to grab their body and pull yourself forward. And that's what we want each segment to do. It accelerates and then slows down like a slingshot, and it transmits that force to the next segment. So these are some of the long drive hitters here, and I use them as an example because they really accentuate and exaggerate the ground reaction force and the movements. So if we look at the foot action here, there's a lot of driving and jumping with the feet. They squat, they push back on their lead leg, and that helps to counteract the centripetal force of the club as it goes around. And also, there's a lot of side bending and rotation in the trunk. So you can see all of that motion. Now, for amateur golfers, the one thing that's the biggest contributor and that's mostly linked to lower back issues is a swing characteristic called reverse spine angle. So this is an overextension of the upper body. It's not rotation. It's basically when the core shuts off, and then that results into low back pain. Now, ideally, when we're at the top of our backswing, our torso needs to be tilted away from the target line or our target. But for reverse spine angle, that's basically when the spine angle is tilted towards, right here, towards the target line, right? So this can happen due to limited thoracic rotation, tight hips or tight shoulders. Because a lot of times people will go to the top of their backswing, try and get the swing larger or bring their hands higher, and that creates this overextension. And that separates the thoracic spine, the torso, from the pelvis. And when we have this opening that happens, I'll show it right there, when that opens, that shuts down the core. The core turns off because it gets stretched. And when the core abdominal muscles are turned off, that reduces the ability for the lower body forces to get transmitted into the torso and then eventually into the arm and the club. And it also unlocks your lower back. So the lower back becomes a mobile segment. All right, reverse spine angle. If you are a golfer that has some type of degree of a reverse spine angle, it's not if you have back pain, but when, okay? Because it's eventually going to happen. All right, so a couple of different stretches that we can do, and I'll demonstrate this in a second, is this open book stretch. So the open book stretch is you're going to be lying on your side here and then pulling your ribs as you're holding your legs down. And you're moving back and forth because it is a dynamic stretch, okay, to address the thoracic spine. The next one is the hip drop. And the hip drops are a wide stance with the feet, trying to keep your ribs still and moving your knees side to side, okay? So I'm gonna kind of demonstrate that if we can kind of go into my two-shot here, hopefully. And I'm gonna pull this down so you can see. So the first one is this open book. All right, so the open book stretch is very important that we position the lower back as rounded and as flexed as possible so that we can get that rotation, not from the lower back, but from the thoracic spine. Okay, so you're gonna lie on your side, and the key thing here is to get your hips higher than get your knees higher than your hips, okay? If my hips are lower than my knees are in line with my hips or lower than my hips, then my back is gonna be unlocked, and that's gonna rotate when I get the stretch. So I'm gonna bring this up so it's almost like I'm in a fetal position, really rounded, flat back. I'm gonna monitor what's going on with my knees and hold that still as much as possible with my bottom hand here. And my top hand is gonna grab the ribs, and then we can rotate the torso repeatedly to the other side, all right? So what happens here, a lot of times people will pull, and then all of a sudden the knees will move or the pelvis moves.
We want to keep that nice and still and then rotate through there repeatedly, about 1.5 to 2 minutes. All right. The other one, the hip drop, is done in a flat position here. The key is to keep your ribs, at the very least, in contact with the floor. Okay, we don't want to have your ribs kind of pop up when we rotate. If we did this with a very narrow stance with the feet and the knees, as you rotate, that immediately pulls my pelvis and my lower back into it. Again, we want to isolate this mobilization to the hips. So I get my feet as wide as I can. The wider my feet are, preferably wider than my hips, the more I'm going to rotate through my hips as I do this instead of my lower back or my torso. So here I am, I'm going to rotate my knees side to side, keeping my feet wide, and my hips are moving and not my lower back or my ribs. All right, so I have this wide stance going side to side, again, 1.5 to 2 minutes. The speed can be slow and controlled. Again, here is the wide stance, and you can see how my back and pelvis are moving versus the narrow stance, and then all of a sudden I just go, and then all of a sudden things get pulled over here. We don't want to see a lot of space underneath the ribs or the lower back. So wider stance is better. All right, so those are a couple of the mobility stretches. Now let's get into some core exercises. Now, the one thing that is really good in terms of generating force and protecting your lower back is keeping the abdominals on. So let me just pull up my slide here. So the core exercises, core stability exercises. Like I mentioned before, let me pull up my, my 2-shot here. If I'm gonna be addressing the ball and I'm going to the top of my backswing, if my torso is tilted towards the target line, if I'm here and I'm tilted this way in an attempt to get my hands higher, then that separates the space here, which shuts off the core. We want to connect the core, the abdominals, connecting the pelvis to our torso. So as I rotate, I'm rotating over that fixed axis, keeping that on. And then at the top of my backswing, my torso should be tilted slightly away from the target line. Okay, so one of the easy exercises that I like to prescribe for people that need to engage their core, especially for rotary sports like golf, is an exercise called the PAR5 press. So one of the simple exercises here is just getting a cable, a band, or strap, something resistance perpendicular to the body. We have it perpendicular to the body, just to the side, and I could start in a kneeling position, engaging my core and my glutes, keeping everything stable, and taking this band, strap, or whatever out in front and holding this. This is like a plank almost. You want to be able to hold the arms or strap. You can put your hands together if you want, but whatever happens, it's going to be directly in front of my body. I don't want to be able to, I don't want under rotation or over rotation, right? So I'm just here, everything's straight, my hands are closed, so I'm organizing my midline, my core is on, and I push my arms out directly in front of my midline, and that enables me to engage my core and challenge my stability with rotation, all right? Another variation is a half kneeling position, but everything stays the same in terms of how the movement is performed. The glutes are engaged, the abdominals are engaged, and I'm holding this, okay? So I can hold this for 10 to 15 or 20 seconds and work on the endurance and control of my abdominals. And then from here, I could start to change position up into a golf position, a hip hinge position where this is slightly higher. I'm gonna assume my golf posture, and because my torso is tilted forward slightly, my arms are not gonna go horizontal, they're gonna go perpendicular to my trunk, which is somewhere here. We don't want to be down where the club would be. I'm just going perpendicular 90 degrees from my chest. So I'm right here, and I'm going to hold that position. All right, so this is some variations, different examples of the PAR5 press. Another one that I like to do for correction of this reverse spine angle is the PAR5 press using a band in a driver's stance. So I take this band, I loop it under my lead leg, I put my hands around the band, and I put it right on my chest. And again, here I am in golf posture. I'm going to take my torso and my hips to the top of my backswing here for a driver, and then I'm going to stick my hands directly perpendicular from where my torso is, all right? So my spine angle is here. I'm going to hold my arms out like that. So again, not back where my hands would be for a club and not the top of my backswing. It's basically just a torso where my sternum is pointing and I'm holding that. And we want to try and keep the head and spine in line. If I was going to hit a ball, I want to be able to hold that position. So holding this position here really forces me to engage this core and get my pelvis connected to my torso using my abdominals. Alrighty. So these exercises really help to prevent this reverse spine angle, which is the #1 cause of lower back pain in amateur golfers. The core stability and lumbar stability, lower back stability, but hip mobility, the hips have to be mobile, and also your thoracic spine needs to be as mobile as possible. All right, so I'm going to check the chat and see if we have any questions before I wrap things up here. Hopefully you found this session informational, informative, and helpful. All right, well, thank you for joining me today. You can look for this session and many more on demand on any of the Better Spaces apps.